Hi, today we're going to talk about human resource management functions in pharmacy. One of the things you have to think about, especially when you are doing strategic planning, thinking about what operations that need to be performed in your pharmacy, is who are those people that can do that job for you. So, what we're going to do in this lecture, we're going to explain the importance of HR in providing quality pharmacy services, describe some of the legal importance of HR, identify some critical steps in employment recruitment, discuss the key steps in, you know, employee hiring, and discuss some of the employee motivation and performance feedback. Why do people make a difference? Often when we start our own business or we're working for a company, we have to realize there is more people. It takes a team to make a company work. And human capital is essential to any organization's long term performance success. Obviously, companies, businesses, organizations perform better when they treat their employees better. And that does not necessarily always mean in terms of salary, it also means in terms of what they can get out of the job. And human resources are a key to organizational success or failure. Also, too, large companies have people that specialize in human resources, but often if you are a one, a one small company, small business, the ability to do to hire somebody is not always possible. So often, all those human resource, um, you know, needs falls on you, the owner. As I said, employees are the most important asset of an organization. The quality, the effectiveness of the organization is determined by the quality of the people that are employed. The people that you hire are a reflection of what your mission and your vision is of your company. Success for most organizations depends on finding the employees with the skills to successfully perform the tasks that you have developed through your organizational, you know, planning, through your strategic planning to attain your strategic goals. So, what is human resource management? Human resource management, in the simplest definition, is the field of management which has to do with the planning, the organizing, and controlling various operative functions in developing and maintaining a workforce. I think that's very important that this is an ongoing process. Just hiring somebody is just the initial step. The ability to make that person grow within their job, to educate them, re educate them, is always a consistent task that we need to be thinking about. The objectives for which the company is established are attained as efficiently and economically as possible. There is a lot of resources especially economic resources that go into place in hiring somebody, and the ability to train that person appropriately and also retain them is important. The other thing too is there's lots of different rules and regulations that are set both on the federal level and the state level, and that is necessary that we are treating employees fairly and we're giving them opportunities to succeed within our business. So, HR management is an essential duty for any pharmacist who must interact or supervise others. Often, as we talked about at the beginning of this course, pharmacy in school, we're not always taught, management skills, but a lot of times we're taught great skills about how to educate patients, counsel patients about their diseases and their drugs, but we're not really always taught well on how do we lead others, supervise these others. The other thing too in being able to be a successful business is what are your skills in recruiting new employees, hiring them, developing them, and sometimes a very difficult one when an employee is not working out over a period of time. How do we terminate an employee? What are the benefits in performing these tasks well? Well, the benefits is obviously that you are able to take care of your patients, your customers, and also succeed in the goals that you foresee in your company, especially in your strategic plans. According to the American Management Association, human resources is a field of management which has to do with the planning and controlling. What human resources helps you obtain the objectives, for your company, and also, making sure those people are doing. I'm sorry, we got a double slide there. I apologize. So think about problems that occur every day in your pharmacy, and think about the employees that work for that company and things that we may have to deal with. Like, how do we prevent dispensing errors? But how do we respond when a dispensing error occurs to our patients? How well do our employees are aware of the importance of inventory control? And how well are they performing those tasks? Obviously, we would like that all employees get along with each other, but that's not necessarily the case. And when we do have employee disagreements, either with them directly or with other employees, how is this maybe affecting the workforce, possibly bringing a hostile environment, or leading to other allegations that could harm and hurt your business? Because ultimately, if those top three are not functioning, they also can lead to poor customer service, and therefore you're not having repeat customers. And why does this occur? Somebody's being poorly managed and not led effectively. Results of poor management. Sometimes people become overworked and stressed. Why does that occur? Maybe they're not effectively using their time management throughout the day. Maybe they are unclear of what their job description is and what goals they need to achieve, especially during those days when we may not be as busy as it seems. The other thing that can lead to poor success is poor teamwork, making sure employees are knowing how they need to rely on each other. And then also, if you have like a pharmacy management or a lead pharmacist or a lead technician, are they trained appropriately to not only do their task, but also to be able to delegate and enforce that other people are doing what they're doing? Another important thing in the leading of people and in the management of people is providing adequate feedback about how well they're doing in productivity and the quality of their work and performance. There are many people who do not know the skills of communicating this, and either A, they're more forceful and the person's not listening because they're just being directly yelled at, or maybe the person is too nice and not able to give good constructive criticism. The other thing is there are going to be conflicts between people. Unfortunately, we don't always learn from when we were young how to play nice in the sandbox. And how do we handle those conflicts, and how do we make people want to work together as a team? In pharmacy, one of the most important things as a team is we need to make sure that the medications that we are dispensing are error-free from drug interactions, right dose, right drug, and emphasizing quantity for quality, especially in community pharmacy, which can be very stressed because we've created this high-paced environment, sometimes making our pharmacy more of a commodity and patients unaware of all the tasks that we are doing. And often, if we don't have good workflows, good organizational structure, good quality control to check our workflow, poor dispensing habits can lead. Other things can inadequate supervision of technicians, poor communication of letting them know what are the tasks they need to perform, and if they are not performing those tasks, why are they not doing it appropriately. Another important one that leads to problems such as in audits or legal ramifications is our staff understanding the importance of medical documentation that occurs in the community pharmacy business. There are also many laws, and why large companies do hire a human resource department is one, we should always be consistently thinking about, recruiting, because we never know when we may lose a good employee, or we never know that there might be an opportunity for growth that we need a new employee. Also, there are so many laws between hiring and maintaining an employee that change from year to year for, whether it's on the state level or on the federal level. I'm not going to go into all the laws directly, but please refer to the chapter in pharmacy management about these laws. But there's laws that influence, such as the Federal Civil Rights Act of 1964. This prohibits the discrimination in employment hiring, promotion, compensation, and treatment. It focuses on that we can't, discriminate against gender, race, religion, sexual preference. The Title VII of the Civil Rights Act of 1991 prohibits discrimination on the basis of race and places the burden of proof on the employer. So making sure that when we are hiring, that we are documenting appropriately of what we are doing in terms of interviewing, and that is why job descriptions are so necessary to help protect you from a legal standpoint. We also have laws that affect age discrimination. We have the American Disabilities Act. If you've ever had to remodel a business, you need to have your business not only for your customers to be able to be ADA compliant, but you need to have it ADA compliant for your employees. We also, in the 90s, got the Federal Family Medical Leave Act. And so, sometimes it does not affect small businesses, but if you, employ 50 or more, that's another thing you have to look at. As your business grows, some of these laws become more impact, on your business. There's also Equal Employment Opportunity Commission, which was created in 1972 to help enforce the Civil Rights Act. And so often you can be subjected that if an employee wants to file a suit against you for discrimination, you need to understand the processes that go into place there. But once again, this lecture is more to focus on the key things that you need to reflect on. Are you doing well in your business? And often do we need to maybe not hire a full HR department, but we may need to seek outside consultation of HR. And there are numerous companies that do this. And when we meet in person or when we talk via GoToMeeting, please feel free to ask me, and I can share with you some of those companies that do exist. One of the things the Equal Opportunity Commission influences is diversity in the workplace. We have to, that this also affects how we can interview. The discipline of employees requires certain procedures to be followed and documentation kept. A lot of times you can rely on this commission to get resources of effective interviewing and how you can minimize not offending any of those laws. Other laws that affect us as pharmacy is OSHA. If we are dealing with any point of care testing, immunization, we have to make sure our employees are trained properly, and that we have policies and procedures to protect against safety, such as accidental needle injection. Other legal issues in HR management, we have to be very conscious about sexual harassment, and realizing it is not always a physical thing that warrants sexual harassment. It also can be a verbal. And so we have to be very careful with that, especially in today's era. So you always want to check the laws and regulations of your state too. If you looked at, the overview of HR, our model, obviously at the top of your business you have your mission and vision. You have your strategic goals, your organizational chart, current, laws, that policies and procedures that go into place. But human resources is designed to help plan for future employee needs, training and developing employees, reviewing of employees' salary, benefits, recruitment and selection, and performance management. If you are currently Medicare accredited or have gone through the Medicare accreditation process for your pharmacy, there is multiple areas of your policy and procedures that really has to focus on human resources, such as, an exit interview if somebody leaves or you fire them, making sure that you have your, what does your form for application look like? How often are you doing employee reviews, which should be done on a yearly basis? So putting together your team for recruitment to hiring and the retention of employees. Let's look at this and focus on this a little bit. Hiring the right person. Hiring the right person for the right job. Making a perfect fit. The best way that I can tell you, in my experience, to be able to make this work is before you even attempt to hire that person or you attempt to promote a person, is you need to sit down and write an honest job description. You need to go into detail. What will be the requirements of that person? What are the qualities that are going to take for that person? You need to think about. Because hiring and retaining good employees is the most critical factor in the success of your business. You can't be there 24/7, and you have to realize a good pharmacy owner, pharmacy manager, that delegation of tasks is necessary for a business to function properly. The other thing to realize is the average cost of an employee mishire can be 15 times the base salary of anybody, of all the extra work that comes into play in dealing with people that may be not performing their job the way they should be, personal conflicts among other employees that they're not the right fit, and also the costs that come into play in firing a person, terminating them, and having to recruit and rehire a replacement. So, what are the negative consequences associated with losing a pharmacist or technician? Those are, shortness of staff for a period of time. The ability to find somebody that can fit in. All the training that is necessary on the utilization of your computer, the policies and procedures, the ability to build a rapport with your customer patient base. There are 8 stages in terms of hiring an employee. Is the first most important one, and this is part of what will be in your final strategic project, is for your strategic project you need to write a position description statement of what those jobs look like, from the pharmacist to the technician. These may be people within your own company that you're promoting to these positions, but you need to have that description in writing so they understand what their purpose and mission is. Recruitment. How do we get people to want to come to work for our company? Interviewing. Reference checking. I can't stress enough that not only do you have to have good interviewing skills to find out the importance of the skills of the person you want to hire and all their strengths and weaknesses, but making sure what they tell you in an interview is correct. And for those who do not check references, can be very difficult. Often, too, in that referencing checking, we are required, especially if Medicare accreditation, and may be required by the state, to do criminal background checks. Hiring, the ability to make an offer to the person. When can they start? And then also realizing that once you hire that person, you need to have that 90-day period where what is your process for training? There's the old training by fire, just throwing them in there, but at the same time, there should be, in writing, things that you need to review with them to make sure they're meeting the goals to be part of your company. And so employee orientation, training, and getting feedback, which can occur in your, yearly reviews with your employee. Also, having the ability to, when you hire somebody, giving that 90-day period to review them and them realizing that in 90 days, if it doesn't seem to be working out, they may not be there for the position. So when we look at position descriptions, the following should be there is the benefits. Employees understand their jobs, assigned tasks and duties. You need to realize the legal support for hiring or not hiring. What is the compensation, the promotion, for that? What is your state? Is it a state, that you are allowed to, is it an at-will hire state? And you need to have that in writing legally. What are your rights to terminate somebody if it doesn't work out? All right. So making sure that the position descriptions are appropriate. You should always be recruiting too, because you never know when an employee might get sick, an employee may leave, an employee may retire. So what are good referral services to be recruiting? Current superstars in your pharmacy may be talk to people at other pharmacies and aware of somebody that might be a good hire that we actually steal away from another company. Pharmacy schools, technician schools, these are good places to either go give talks, attend job fairs. Pharmacy associations a lot of times have the ability, there's usually a fee, but to advertise, do job fairs. Online job forums such as LinkedIn, job fairs. Your website, is there a place that somebody can inquire for an application? And you should always be collecting applications, even if you don't have an open position, because once again, it's always good to have a good referral source, especially when the day comes that I need to replace somebody, I have a new position, somebody's retiring, because the amount of time that spends in recruiting is a constant burden when you have to do it. So, screening tools. Some things, applicants should be aware of an at-will statement, all right? They should be aware that they need to release reference check, and then if they lie on anywhere in their application, there should be a perjury statement. Once again, you probably, there are good resources with the Equal Opportunity Commission. Check with your state resources, your local small business associations, to get examples of this. Your pharmacy organization, NCPA, has tools that you can actually purchase about HR. So making sure your application, and then check with your federal and state laws of what you may and may not have on that application. You're going to collect resumes, but beware they can be artfully written deceptions. Making sure that what do you want on that resume? A lot of times people will write their own resume, but what is the information you want to do? Because you want to review those before. Look for things such as, time periods off, where did they work, the length of time they stayed at jobs, and you want to be able to sift through. Separate those resumes into 3 categories: strong, middle of the roaders, and unsuitable. And does their skills that they list, does it meet the justification of the job description that you've created? Interviewing. Ineffective interviewing. There are 4 main failures. That not spending time analyzing the job. that the person you go to hire did not realize or did not analyze what the position entailed. Asking the right questions, both the one wanting to be hired and you, the interviewer. You want to describe your business, to describe what the job is, but you want to let the applicant dominate 80% of the interview time. Overly trusting your gut. I strongly encourage that you have a second person within your company to be part of the interview process, whether that's in the initial interview or doing a follow-up interview. Wrong hiring decisions are costly. Not interviewing more than one applicant. Making sure that you have gone through that pile. And what is your period of time of recruitment, and when are you going to make that job decision? Making sure you put that stuff in writing for yourself is important. Keys to effective interviewing is having the job description that the person wanting to be hired has seen. Identifying the key functions for the right candidate. Prepare questions ahead of time and stay consistent with the questions that you wish to ask. Having maybe a rating sheet that, other people that are interviewing or even yourself can rank those people that you interview. Calling back for a second interview after the initial contact and getting somebody within your own company to sit on either the first or second interview. Reviewing the applicant's file ahead of the interview, because not only are you hoping that they perform and ask and meet the requirements you're looking for, but you are also being interviewed yourself of whether or not that applicant thinks this is a good job for them to come to work for you. And as I said before, having another key member of your business sit on that interview that you trust their opinion. Some questions that you may ask. Tell me about yourself. Tell me about your educational background. Provide me a brief summation of your professional experience. Why did you choose this career? Why did you seek a position with our business? What is your perception of a typical day in this position? Why do you think is the most challenging aspects of this position? If they've worked in the pharmacy, ask them things such as how they've handled, working with other colleagues if there's a conflict. How they handle patients or customers if there's a conflict. What makes you unique from others applying for this position? Tell me about your most significant professional accomplishments. If they've left multiple positions, why did they leave that position? Have they ever been fired or forced to leave a position? The other thing I said before, there are questions to avoid answering. We must make sure that when we are doing the interviewing, we are following all the discrimination laws that I talked about earlier. Things that we can't ask. How old are you? What is your marital status? What is the age of your children? Do you plan on having children in the future? Do you have any physical limitations? So here's some examples. Acceptable. What days can you work? What hours can you work? Unacceptable. How many children do you have? Do you have a babysitter available? Acceptable. Are you legally eligible to work in the United States? Unacceptable. Are you a U.S. citizen? What country are you from? Acceptable. This job requires someone who speaks more than one language. What language do you speak or write fluently? Unacceptable. What is your native language? Acceptable. Have you ever been convicted of a crime? Unacceptable. Have you ever been arrested? Acceptable. Do you have a high school diploma? Do you have a university or college degree? Unacceptable. When did you graduate? Interviewing mistakes of the candidates. Candidates come inappropriately dressed. Lack of knowledge about the position. They're late for the interview. Being not engaged in the interview. And that could be not asking enough questions. Responding poorly to predictable questions. Poor body language. Unclear or irritating speech patterns, focuses more on the self-interest but does not seem to have a team approach in being hired for your organization, showing either underconfidence or overconfidence. Another thing I said earlier, I can't stress enough, it's important to make sure that you do reference checking. Because if you do this, it helps gain insightful information about the applicant and protects from any negligent hiring suits. The other thing too is you do have to get approval from the candidate for the reference checks, so you need to be asking, you need to provide references. I strongly say ask for at least 3, and one of those should be, they should not be just friends. If Medicare accredited, you also are required to possibly perform a criminal background check, and depending upon your state, you may require yearly checks, especially those who are professionally licensed. So, when we're thinking about hiring this person, can this person perform the basic job? How well do the candidate's skills and capabilities mesh with our organization's needs? Will the candidate make my job easier? Would I want to work with this person? I think it's also important when we're hiring somebody in the medical field of how well their skills are. One of the things that we always think about, that not only is pharmacy about preparing, dispensing of the drug, but we are in the education business. We are in the business of making sure patients are aware of their medications, and as we are going to a more clinical type of business here in the future, we need to make sure our employees are know that we need to be helping patients to improve their outcomes. So think about the jobs that you do in your community pharmacy. What do you want your employees to be part of? The whole part of the traditional practice, and from interpreting the prescription to filling the prescriptions to resolving clinical conflicts, to our evolving practices such as MedSync, MTMs, immunization, or collaborative practice with physicians. One of the things I've done with pharmacy candidates in the past, especially if I'm giving them a clinical role, I kind of give them a test and I kind of present them with a patient that has come in. And we can talk more in detail about this if you want to when we talk in person. But one of the things that I do is I give them a scenario. For example, somebody comes in, wants all the prescriptions filled, and they're not sure. And so I kind of list out the medications, and we discuss, how would you review these medications? How would you identify those? We don't traditionally do this in an interview process. I used to do this when I interviewed for residency positions years ago. But I think sometimes, too, it's okay to give some scenarios in your interview to see how well a person will respond. Sometimes I do things such as testing their third-party knowledge and asking them what they would do in different scenarios. And so I have case bases to evaluate that. And you can just take a look. These are different ways of how we would handle formulary issues, Medicare Part D issues. But I think sometimes having some testing knowledge in your interview is good. So when we're hiring, we want to make the employment offer. We need to assure the start date, time, and confirm the salary. Review your hiring checklist, such as what training will be required, what are their initial benefits. Some benefits may not kick in until they're fully, with the company, such as 401k, health benefits, when they can actually take vacation. If you're hiring a minor, you need to make sure you're getting work permits, copy of active driver's license. It's important, if you do not hire somebody, sending them out a rejection letter, because maybe there was 2 or 3 good candidates for the position, but you couldn't hire all 3. Making sure you keep that rapport professionally, that sorry you couldn't do this, because maybe this is somebody you might hire in the future, and it's important. Making sure that you have an orientation book and handbook that your employee can go through. And obviously, too, Medicare accreditation has really stressed some of the trainings that are needed, such as fraud, waste, and abuse, OSHA training, HIPAA training. So all of those are part of the process in hiring. So in the training, we need to identify the skills that are lacking in the new hire. Simple things such as, making sure they know how to use our dispensing software. Motivate and familiarize employees to the new skill. sure employees have basic skills required to learn a new skill, teach specific skills, arrange for the employee to apply to the new skill immediately, and then be consistent, fair, and communicate criticism and also praise. I think praise is necessary too. There's numerous studies that have shown that employees sometimes just want that feedback, to let them know how well they're doing or not. Why do employees fail? The employees do not know. They don't know what they're supposed to do. They don't know how to do it. They think something else is important when they're doing their daily tasks. There's no positive consequences for doing something, and there may be no negative consequences. They are rewarded for not doing it. So why would they do anything extra? They are punished for doing what they're supposed to do. They are not and will ever be capable to perform as desired. So maybe this person should not have been hired in the first place. They're also maybe struggling with personal problems that are getting in the way. These things we deal with every day. And sometimes we can become very good at it. Sometimes these are skills ourselves as pharmacy owners and pharmacy managers we need to work at. In terms of retention, for employees, the greatest single job satisfaction is being appreciated for what they do. Numerous studies have shown that it ranks ahead of working conditions and salary. And making sure we praise people when they're appreciated, but giving constructive feedback and letting them know we're giving this so that they can perform to the best of their ability. An employee that is publicly or privately appreciated for doing a good job will work harder for less compensation anytime. Importance that you adhere to employee reviews, and especially the new hires 90-day review. So, in terms of training, you should have an orientation list, have a development checklist, such as, simple things as filling a prescription, calling third-party plans, calling doctors. What are things that they're allowed to do in their scope? If it's a technician, what are things that they need to make sure the pharmacist checks before anything happens? And, job training. What are those examples? Obviously, too, when you first hire somebody, you want to make sure you have enough people on the staff so that person's not the main person doing the job, but able to work and learn and follow what people are doing. Development is different from training. As you get somebody, having your own pharmacists or technicians, how often have they attempted a pharmacy association meeting? How often have they attempted, training such as customer service training on a new skill such as MedSync training? And so think about your goal, Tom. You want to do compounding. What people are going to be required to do training? It may be sending them away for the training. It may be training right there on the job. How do you develop and further your employees? When you do an employee review, it should follow equal opportunity policies. The information on an employee review should be in an employee handbook and should state when did it occur. Most employee reviews are within a year from the date of hire. But there also, too, if it's a new employee, doing a 90-day review from the date of hire is very important. I strongly, encourage that. The review should always be face-to-face. It should be a written documentation that the employee and the evaluator sign. You may also want your employee to do their own evaluation of themselves, of their strengths and weaknesses prior to the interview. And I can share some of those with you, and I will be posting that on our website. If you have to get rid of somebody, ask yourself a few questions. Is the employee clear on their job duties and company regulations? Is the employee underachieving because they aren't challenged enough or is too demanding? Is there conflict with co-workers, immediate supervisors? Are personal problems interfering? If no, because any of the above, possibly that person could be saved through training, through talking things out, through other development programs you may put them through. But if no is the answer to all of those above, it's probably a good idea to cut your losses. You should investigate the employee before determination. Think of questions from the previous slide. You should review the employee's personal file. Always document when you needed to discipline, because if you don't document these things ahead of time, getting rid of that employee may be more difficult. You should have making sure that your policies and procedures that the employee may not be following is in writing, so they're aware of what the consequences are for being late, for excessive calling off. Consider what your employee was told verbally. Consider the context of this potential firing. Consider your options and do not take firing lightly. And I've done this about 5 times in my life, and it's never easy. But, you need to also, too, is if you think there's legal things that may come back, consult your attorney to get your blessed decision and have a proper plan for determination. The next steps for HR management. All right. I'm posting an article about pharmacist-led chronic disease management. And what I want you to do is read this article. This is going to be your assignment. And I want you to write a job description about the future of a community pharmacist working in a community pharmacist with a collaborative disease management. And I want you to also, in that job description, outline a training and performance feedback mechanism for this new job description. I will post this separately on the website, on the course web, so that you do that. But this assignment, think about this assignment is just to practice what your job description would be. So as you're doing your strategic plan, you will be writing a job description. And when we talk and meet, we'll review this and answer any other questions about HR. Thank you very much. I know this is not the most exciting lecture in terms of management, but there are numerous resources out there about HR management. I encourage you to read the chapter, because this is something, when we talk about job development, I think often too, this might not be one of interest, but an important one we as owners, employees, managers need to do is how can we strengthen our human resource skills. Thank you, and have a good week.